Everyone, if you will, stay on mute until we get to the Q&A section. You can also drop your questions in the chat. We'll make sure we get to them. We have a good quick hour. We're going to get some information into you. So to start, I am Alicia Diggs. I am one of the co-chairs for the Women of Color Rise Up through the National HIV and Aging Network through NMAC. And we have our marvelous Cecilia Dennis, who is also a member of WOC, and then our fantabulous Vanita Ray from Black South Rising, and so many other things. Everyone knows Vanita. We love and appreciate you. So to go on ahead and get started, y'all, I'm gonna just start sharing my screen. Oh, I didn't mean to hit not share. Y'all know when we've been on Zoom and stuff for so long, and it's amazing how we still don't have it all together, but it's good, it's
It's
good.
all good.
So today, everyone, we will be discussing political determinants of health, building power to improve health outcomes. And I'm going to go ahead and pass the start over to Vanita.
Thank you, Dr. Diggs and Cecilia, you all the women of color for having me, for having Black South Rising here. I am thrilled. I know a lot of you all here, so not that I would put on airs, but I'm gonna just be me. I've been around in different places, but now have a nonprofit, Black South Rising. Some of the folks to the right here are who are part of it. I think we have one or two new people. We did a retreat in October. Black South Rising isn't new. We've been around since 2018, but we were just kind of meeting and nobody wanted to really get formal because we all were doing so much. And when I left PWN and thought about it, the political moment we in really is a great opportunity for Black South Rising to serve community. So we are here, we exist to build political power to improve health outcomes um, for the Black South. And, when we say Black South is just the majority of Black folks who live in the U.S. happen to live in the South. And it is the site of so much historic pain, but a lot of historic joy, resiliency, legacy, and history that I'm proud to be a part of. Our vision is that we envision a South where political power is held by and for Black Southerners, where our collective quality of life is evidenced by dignity, respect, and well being. If you've been checking the news, you know that ain't the case today. So we will keep that vision for all of us and hold it for all of us. But blacksouthrising.com is our website. You can go to the next page. I don't want to spend much time talking about us. You will hear more about us. Some of the learning goals here are just to describe how policy and power shapes health inequities. That's from a historical standpoint and even today. And, I happen to be a woman living with HIV, y'all, you know that, but you don't see a lot of HIV in this, although we're grounded in HIV, but HIV is a health condition and we're talking about health inequities and it really talks about why HIV is we're disproportionately impacted. So we'll talk more about that. We want you to be able to differentiate between the social and political determinants of health by the time you leave this meeting. We also want you to be able to apply this political determinants of health framework as a way to build power and identify those actions that advance equity, health equity for us. And then we're going to talk a little bit about understanding intersectional solidarity as a part of the women of color group here. And that's kind of the way they want to work. And so we'll talk a little bit about that. So let's get it on. And I'm going to turn it back over to Alicia. Dr. Diggs. Dr. Diggs.
Thank you, Vanita. So everyone, if you will, scan the QR code. We're gonna just do a little quick icebreaker here. What words describe the unique issues that
Please leave your
prevent us?
message for
that prevent us from having the world you want to see. I'm also going to drop the link in the chat after I stop sharing the screen because some people may be joining from their phones and can't scan the QR code. So if you will scan that really quickly.
Okay, I don't see a QR code and I'm not on my phone. I'm on my iPad.
Okay,
So I don't
does anybody else see the QR code?
See it.
Hi, this is Yolanda from Houston, Texas. I
Yes.
see it. I
Yeah.
see it.
Yeah, I see it
don't
as
know.
well. It's that black, you don't
It's
see that.
it's
see it.
probably the iPad that does that. So
Okay.
I'm gonna
Okay.
stop
I
sharing.
went I see it now,
Okay,
but I
awesome.
don't see anything else, just the QR code.
Yes, you scan the QR code, you open up your camera and scan over it, and then it will give you a link that you tap onto. So I'm gonna also put the link in the chat. It'll probably be a little bit more helpful. So those who haven't scanned, give me a minute. I'm gonna stop sharing because I am multitasking myself away, which is what we do because we're amazing, right? So I am going to put that in the chat for you all. Maybe let's send a file. Somebody's trying to send a file. There's the link. I am seeing some stuff pop up. Does anybody else need the QR code before I start sharing again? Think you got it. Think you got it. Y'all are amazing.
Mm.
So we seeing some, wow, racism is big, stigma, white supremacy, jealousy guarded. Ooh, it popped away from me. Poverty, homophobia, economic disparities, inequity, hate, government, love, discrimination, gender inequality, misogyny, jealousy guarded, privilege.
I think they're trying to say jealousy guarded privilege, maybe.
I never heard of privilege.
Mm.
Peace, funding.
There may be a new word. We might need to add that.
We need to make sure that it's something that,
Oh, Michael said yes, it should say privilege.
okay, great, Michael, thank you.
Funding cuts, yes.
Oh, that.
Government, whoa.
Right, current president. Ooh,
Yeah.
Oh.
Homophobia, perfect.
greed.
Mhm.
Hmm.
Wow. Thank y'all for entertaining us with that.
Yeah,
Yes, I'm gonna go on ahead and stop sharing. If
they
y'all,
pretty much named all the things, huh?
they named
Hmm.
all the things. I love it. I love it.
Yeah.
I appreciate y'all. Thank you for taking part in that. It is important that we do some of these things.
Yes. So thank you all for that. And
Uh,
it just helps me, as a presenter, and I appreciate Dr. Diggs and Cecilia doing that, to get a sense of what's in the room and all those things you all said, the sentiment of this group, we are all in the right place because we can agree on those things. And how do we fight them? How do we change this system? How do we get a responsive government? We've got to start back with some history and coming forward and looking at a power building framework instead of, we advocate, but I'm just reframing the way we advocate. And so one of the reasons political determinants of health are important in today's climate, I just Project 2025 is just one example. You all
Mhm.
just showed a whole bunch of other things why it is so important for today. But this document was a political document. It was named leadership or something, but the whole goal is to take from the gains that we have had and to marginalize, minimize, oppress, erase folks in the case of our trans siblings, but to roll back all of these things and to promote this white supremacist, which has always been there, but it's just a lot more open. So let's be clear. Trump didn't create this. This shit was here. This is
Right.
the founding of America. But to eliminate bodily autonomy, to limit and dilute our right to vote, getting rid of the Department of Education. I mean, it's just humongous, and it's designed that way, and they've implemented a lot of this. And so as we've been trying to figure out how to fight back, it's because you got arrows coming from every direction, because this is just one summary, but you all have heard about so much. And so we need our own political power building framework in order to respond in this, whether you started in this as HIV or you started somewhere else. The power building is the same that we need to do. So next slide. But and it was an interesting fact. Kevin Roberts, the guy who was the head of Heritage Foundation, who's the author of some of this, has a PhD in African American studies. So before he did this, he went and learned about us. Okay? Not because he loved us. So think about that. We've got to study differently. And I want to start off with a little bit of the historical context for where we are now in this fight for health equity, which HIV is included in, and so many other conditions that you all just identified. The history of the United States has always resisted health equity, whether through political action or inaction. We've created the structural conditions for these ongoing health inequities, the injustices, state violence, as in criminalization and other ways, especially against Black, Brown, and Indigenous communities. The fight for health equity and those conditions, we didn't come here with all these health disparities, y'all, when they brought us over in the Middle Passage. These conditions are a result of being here. And so the fight for health equity in this country has really arisen ever since slaves were freed by the 13th Amendment. It's my preference. I don't acknowledge the Emancipation Proclamation as a freeing of the slaves. The 13th Amendment, and what it did, though, it said, slavery was outlawed, except if you were incarcerated or part of the criminal justice system, because this country was built on free slave labor. And even for after the Civil War, and these are Reconstruction era amendments, the 13th, 14th, and 15th, there was still a carve out. We got to find a way to still get more free labor. So the 13th Amendment was great in one respect, but in the second respect, to make that exemption for folks incarcerated or part of the criminal justice system allows them to still use free labor, cheap, no labor within our criminal justice system. And to facilitate that, this country came up with all of these kind of laws that made us susceptible to being involved in the criminal justice system, like vagrancy, where two more are gathered. I mean, we came up with all of these broad, ambiguous kind of rules that eventually ended up Black folks being in prison at a much higher rate than anyone else. And one of the reasons for free labor. The Freedmen's Bureau was created, but only lasted a couple years. And so the fight for health equity, and no one wanted to educate Blacks or provide care for Blacks. And so it's been ongoing. And it didn't just apply to Blacks. It might have started there, but poor folks or indentured folks, all of these folks, since 1865, y'all. And so that resistance has created all of the ongoing structural conditions, the health inequities, all of those things coupled with Jim Crow and so much more. We know that the Voting Rights Act wasn't passed till 1965, which sought to implement the 15th Amendment. And we are seeing today in 2026 the erosion of that and where we're at. So, the Affordable Care Act was the first real attempt, which didn't happen to 2010, of some measure of health inequities. We got Medicaid and all that, but the Affordable Care Act was the first time. And since that's been passed, and was passed without one Republican vote, there's been a wholesale effort to eliminate it, which they've almost done by defunding the subsidies. So I just want to just give you a historical overview of what that what we're fighting against. When we're trying to fight for HIV services or this here, we got to realize we're fighting against it in a broader construct. Folks don't just not understand, they don't want to take care of us. Okay. And that more responsive government and all of those things are where we've got to go to get the care we need. I love that Chioma is on here because the calling card for United We Rise, if what would the HIV response look like if it was led by Black people? Well, it would be different, but we need to be in government. We need to be the people making the decisions in order for that to be different. So next slide. Just wanted to present that, and please ask questions. You're going to hear more about political determinants from Dr. Diggs and Cecilia. But I want to just give you an illustration of kind of what we're talking about. Political determinants happen upstream. If you think of a river, political determinants happen upstream. They happen outside of our communities, and a lot of times they happen in government. They happen there. So as you all know, a river, what you put upstream flows downstream. You can't put shit in it downstream and expect it to flow back. Social determinants of health are what results from the lack of power upstream, which you will see. I think it's Cecilia that's going to talk about that next. So I want you to just keep this illustration in mind that says we've got to build power upstream in order for it to flow downstream so that we will get more than where when we say, well, why are Black and brown people so impacted by HIV or other disparities, health disparities? Oh, it's a social determinants. It's a way to just tie it in a bow neatly and not have to unpack racism, all the things that you all just put in that word cloud. And I want everyone who leaves here to never accept when they say it's social determinants. Ask, what do you mean? Do you mean racism? Do you mean whatever? Because we can get positive social determinants because in these other neighborhoods that have more money and all that, their schools aren't low. They don't have low literacy because their schools are better. They don't have bad health care because it's more accessible and they have money. So their political determinants flow downstream and produce positive outcome. That's what we need. So we must build political power upstream to achieve that equity in our lived experience and living conditions downstream. And I think next slide. I think I'm going over to Cecilia. But keep this in mind, y'all. Political determinants are upstream power building versus that downstream trying to solve a problem at the point of the problem. And you know, I could keep going while you figuring it out.
Next slide, please.
Next slide.
And I'm trying to.
I know you are. Take a breath. We good.
Yeah, I done clicked on something and now I can see
Mhm.
y'all and then I don't have no control over my slides. So
Oh,
You want to
no.
stop them for a second and then come back.
oh yeah, I'm gonna
Okay.
get it.
So I want y'all to think about this, and it's I've always had an issue when ever since I was diagnosed in 2003 and got into this movement that I was never satisfied with the answer of the data as the reason why. I always have asked the question why. I don't accept the data. I know the data may be right because I know what I see, but we need to begin to ask the question why. Why are Black and brown people disproportionately impacted? Why are poor people disproportionately impacted? And we're going to talk more about that. But now I'm going to hand it over to Cecilia.
Okay. So those frames political determinants of health as the way relationships, resources, political and power structures exert enormous influence on our environments and in turn on our well-being. But power isn't just one thing. It operates in three distinct systems, and they all reinforce each other. So, of course, we know state power. State power controls the rules, and this is the most visible layer for us. We know after 2010, many state legislators engaged in extreme gerrymandering, drawing maps designed to produce predetermined electoral outcomes. Sounds familiar, right?
Yeah, yep.
While enacting restrictive voter laws. All sounds familiar. All of this was done in 2010. It's a repeat of just a repeat, just a repeat. The system just repeats itself. And all of this is disenfranchising people of color, people with prior felonies. The impacts don't fall evenly. It falls on Black and brown people, so, there's a pattern here. Low income communities and indigenous communities are all the hardest hit, through that system. The connection to health is direct. Under non-representative government, social and economic divides perpetuate disparities in minority, and life expectancy is, of course, decreased. Like, issues like gun issues, control, reform, and insurance coverage that disproportionately impact minority racial groups are reinforced by voter disenfranchisement. Okay.
Yep. Thank you.
Yeah, I mean, courts compounded. So, then we have the courts that step in. The courts compounded. The U.S. has struggled to apply doctrines to equal protection and general welfare laws and policies for more than 225 years. So, there we have it. Implicit bias. I think, was that one in our word cloud, I think, bias. So we have implicit bias are baked in political systems that are, even in the most dire health emergencies, you can't get care, Actions tend to favor some groups over others, Economic power.
Oh, wait, go back to the slide for a second. Go ahead. I wanted to just jump in there to say,
Sure.
Policy choices are, whether they're laws or not, or policy in action, like letting ACA subsidies, are policy decisions. Those dynamics, we see it going on today. All of that occurs in a rapidly occurring authoritarianism or fascism, or not a non-responsive government that favors and decides who gets what, when, and how. You need
Right.
HIV treatment, not you. Nope, that's not a priority. Whoever determines that has that power. That's where the power lies.
So this is the reason rural communities have to travel 2 hours to get specialized care, because the state level decides it's not important. They're not important, and there's not enough of them there, so we're not going to focus on that. So, on a low level. So anyway, then we have the economic power, the lobbying. And what was interesting to me is that 30 health organizations made 40% of all the healthcare lobbying between 2008 and 2020. And 18 of them were pharmaceutical or dialysis organizations. And these are the organizations that are shaping our Medicaid policies and drug pricing decisions and coverage rules and, this type of thing. So, this is the economic power that's impacting us. Then we have the culture and ideological power. And that is the most insidious layer, because we've got somebody in the waiting room. 1 second. The cultural and ideological layer of power. It's the most insidious layer. The white racial frame of political health discourse distracts attention from the historical power. So basically, it's about who's telling the story, how the story is told. It decides. It normalizes everything. So like Vanita was saying, social determinants of health, not asking the why, what does that mean? So in some rooms, they don't have the actual story, so they make the story up, and that becomes the story, the cultural or ideological power. It's the idea, the thought behind the reason for the thing. So it's the reason we don't have, the reason they can't afford, the reason they won't do this type of thing. It's the way it comes from, it started because the way the story is told, who's telling the story. And that's why it's important for us to speak up and advocate for ourselves and tell our own stories, because if we don't, our story will be told for us and they're going to mess it up and it's going to impact us, our political, at a political determined health level. I'm gonna go ahead and turn it on over to Alicia and let her pick up social determinants of health.
Well, can
And
we go back to the previous slide? I just
sure.
just want to break this down, Cecilia, for just a second. And folks,
Okay.
you all don't have to memorize this, but just to show you, there are so many avenues to influence political determinants. Voting is a political determinant, a responsive government, policy work, equity, the lack of equity. You see this over here, political equity, all of that will influence business interests, advocacy down there, right? Institutional, interpersonal. So there are so many ways, and I think we've all been doing this, but we've still done it from a passive place instead of a power building place. We have to become the they in the decision making roles. But you can study this a little bit later, you all, but just to show you there's more possibility when we're looking at the political determinants, which is deciding who gets what and where versus the social, we get what results from these political determinants. That's all I wanted to say.
So in other words, if we don't take some action, if we don't step up in some shape, form, or fashion and do something in relation to this slide right here, or things that are outside of this, I mean, think outside the box, whatever, you know, you feel is going to be effective. But if we don't do anything, we're going to continue to face these social determinants of health, and probably even more severely
Yep.
going
This is where
forward.
we influence policy. This is where we build power.
Exactly. Okay, thank you, Anita, for spinning us back to that, because I skipped right over it. I
That's all right.
apologize.
That's all right.
Y'all, this is her first time. She's doing great. Stop.
This is not my
Right.
first time. That's the thing. It's just been I'm sorry. I do apologize, you guys. It's
Oh
been a
no,
rough
I'm
day.
talking about this
Oh, for this
presentation, baby
training, for
girl.
this particular training,
Yeah.
absolutely. Yeah, and it's been a rough day, so a rough week. So y'all
That's
gotta
all
forgive me.
right.
You got
But
grace
anyway,
all
we
day.
made it through, and I hope you all got the message. And we'll share the slides.
I
You
think they
did great.
did.
And Grace is on here, so I know she give you grace. Go ahead,
Oh,
Cecilia.
great.
Go ahead, Dr. Diggs.
Thanks, Benita and Cecilia. So, I'm going to just talk a little bit about social determinants of health and why they matter so much when we think about health and wellness. And, people have their different ways of defining this. But just for this session, I want to share that social determinants of health are conditions in the environment where people are born, live, learn, work, play, worship, and age that affect overall health, quality of life, and even life expectancy. So, what's important to understand is that health is about much more than just going to the doctor or taking
Oh,
medicine.
yes.
Goodness, many of the factors that shape our health actually happen outside of the healthcare setting. These are what we call the immediate non-clinical factors that influence well-being. So, for example, income matters because financial stability can affect whether someone can afford food, transportation, medication, or safe housing. Education also plays a major role. Access to quality education can impact employment opportunities, health literacy, and long-term economic stability. And then when we talk about employment, it affects health because jobs can provide income, health insurance, stability, and safer working conditions. But on the other hand, unemployment or stressful work environments can negatively affect both physical and mental health. So then when we bring in like housing and neighborhood environments, they are extremely critical. Living in safe communities with clean air, transportation, grocery stores. We know there are so many food deserts all over the place. Parks and healthcare resources, they improve health outcomes. Unsafe and under-resourced neighborhoods can create barriers of living conditions. I just said food security, that's another key factor. Having reliable access to nutritious food, prices going up. So, people have to do what they have to do. Having nutritious food, that supports overall wellness, while food insecurity increases the risk of chronic illness and poor health outcomes. And then social support matters. My goodness, that is so major. Not everyone has social support, but a strong support system from your friends, from your family, the family you create, faith communities, community organizations, they all improve emotional well-being and help people cope during difficult times. And then, finally, we talk about access to healthcare. That's important because people need affordable quality healthcare services to prevent illnesses, to manage their conditions, to receive treatment when needed. And at the end of the day, y'all, social determinants of health, it reminds us that health is shaped not only by personal choices, but also by the opportunities and conditions that people experience every single day. If we want healthier communities, we must also address the social and structural factors that impact people's lives. And this chart right here, like you can really just put it together, and it's basically what I just said.
Yeah.
Um, it really just breaks down social determinants of health. If you're a visual person, like when I first saw this before, like reading and actually getting the information, I tried in my own head to put it together because I'm visual. So to see that, it's extremely helpful. You're right in the middle, and I'm pointing like y'all can see me, but you're right in the middle and everything else around you. And then, really, just, I want to give you a simple way to think about the relationship between policies and determinants of health. When we think about policies and determinants of health as the blueprints and laws used to build a city, social determinants of health are the actual buildings, the pictures, I'm sorry, the parks, the schools, the grocery stores, and the roads that people interact with every single day. So, in other words, policies shape how resources are distributed and which communities receive investments and opportunities. Vanita said that earlier. Those decisions then create the conditions people live in, whether that means access to good schools, safe neighborhoods, healthy food options, or healthcare services. So when we talk about improving health outcomes, we also have to talk about the policy and systems that shape people's daily environments and opportunities. And if you look at this picture here, it really just breaks that down as well.
Beautiful. I love this picture.
That is
This
so
is such a
cute.
good illustration.
And it's interesting, when you really go to make those connections, because we always say, food is medicine. So,
Yes.
you mess with our health care, you mess with our insurance, everything, you tamper with our food, there goes our health. And then we say housing is health care. Okay, you put them out on the streets, so no health care, no food, no housing, no food, no health care. So it's all a big circle. It really is, and it all ties together.
It is, and I want to say that was such a great illustration. Social determinants, which result from the lack of those negative social determinants, because social determinants of themselves don't have to be negative, but the negative social determinants result from the lack of political power. When you think income, the United States we still have is it $7.25 minimum wage. That is not a livable wage. We are the richest country in the world. Why do we have to have so many poor people? Why we have not increased, and it's not even being discussed, the minimum wage, or so many of those
Ridiculous.
things, schooling and all of that, school to prison pipeline, because we know what happens with mass incarceration in our communities, all those conditions that are shaped by decision making outside of our community or by others. And one of the ways, this flows really into this, how that lack of political power creates HIV vulnerability or other health disparities. These are those I want you to all to from here to think of HIV as a symptom of way larger problems.
Mm-hmm.
When you think
Mm-hmm.
of this tree, and HIV is what's the visible symptom, but the root causes are all of these things we've talked about, where lack of economic justice, poverty, racism, discrimination, all of stigma, all of these things that go in. It isn't about behavior. And I know we got HIV, and when we talk about interventions and everybody's focused on behavior, and I am not. Because I don't believe that we did anything wrong that resulted in us acquiring HIV today. I didn't think that before because I let the negative stigma, I internalized that to let people tell me who I was. Today I know it is not about behavior. We can focus on behavior, we can focus on prep, we can do all those things, and I think they're all necessary. But the way to prevent disparities, the way to eliminate conditions like this, a way to address issues that we see occurring in our community, or to address root causes. That means we need to be in decision making. We need to be in the resource allocation. We need to talk about access to culturally competent care. When you have an FQHC, and I've worked at one, that the door, it was free services, but Black people still wasn't going up in there because of the ways that healthcare and that bias impacts us, or not serve us in the way that we want to be served, or treats us as less than. All of those conditions result in that we don't have the same access to the type of care we desire, the type of care we want. We may not believe in all of those types of things because we have our own cultural and traditions that are not negative. So I want you to realize that it wasn't just your behavior that makes us vulnerable to HIV. There's systemic and structural issues that this country has chosen to ignore. And for people in power, someone said on the news today, and we're asking this man, you're talking about the war, but don't you want to address the affordability issues? And he said, well, no, I'm not thinking about that at all. He's thinking about war. I mean, so that's where the political power is being held right now, y'all. We've got a Congress, we've got state legislatures that are not all acting in our best interest and are not concerned with addressing the root cause of some of these problems, because that would mean the loss of power on their end. But some of those I want you to think about root cause analysis when you all are in these meetings, when you all are talking about how we're going to deal with it. We can talk about education, but you're going to educate me on a symptom instead of educate me on the root cause. So I want you to think about structural and systemic bias
Mm-hmm.
in healthcare, in access to care. It is not an accident that Black folks have so many health disparities. It is not because we don't know how to take care of ourselves. Anti-Black racism, anti-Blackness, transphobia. Folks say what the Supreme Court did the other day, we shouldn't be worried about, because it still is one person, one vote, but it was vote dilution. It was one more peeling of the layer of us having representatives that will represent our interests. They struck us right in the political power building that we have, where you now have the state of Tennessee, who only had one majority Black district and potentially could have a representative that was reflective of their needs and desires, that is now gone. That wasn't an accident. We have returned, and I can't even say to the Jim Crow, we are something else than returning to that. So poverty, it is not, even though I used to say and poverty is the greatest predictor of HIV acquisition, y'all. It ain't behavior, it's poverty, right? And I used to say, well, there was the most Black folks who were in poverty, but it is not. I've read some more studies. There are more white people in poverty, but what we know is their experience in poverty is very different than Black
Different.
folks' experience
Yes.
in poverty.
Yes.
The leadership, power, and decision making. We've got to become the they. If you don't have someone reflective over your city council, your school board, your state legislature, and I'm not only pointing at the federal, because a lot of decisions that affect our social determinants or affect our lived experience and our conditions happens at the local level. Intersectional stigma. That's where stigma is not an apple, it is an onion. And I learned that from a kid in Alabama, y'all. That it needs to be peeled. Is it racism? Is it stigma because I'm black? Is it discrimination? Is it HIV? Is it my gender? We have a movement now to repeal the 19th Amendment, to take away the women's right to vote. And I want y'all to remember the 15th Amendment gave us the right to vote, but it gave black men the right to vote. Women didn't get it to the 19th Amendment. Okay? So I want you, intersectional stigma is the term I use because stigma isn't one dimensional. Discrimination, healthcare access,
Mm-hmm.
massacre, all of these things and more are the root causes that only can be addressed if we're in the decision making, we're in the leadership, so that no matter if you're now saying, well, we need help with my copay. Well, what about universal health care? We're talking about the symptom of the problem, helping you with your copay, because you need that today. Mexico just elected a woman president, and they're going to have universal health care starting in 2027. We are the only industrialized superpower that don't have it. So these are the real ways that we make change. We can be advocating for my co-insurance to be paid, but the bigger picture is universal health care. You know,
Mm-hmm.
in Texas, I couldn't go in the state legislature and argue for Medicaid expansion. They didn't want to hear it. So I changed the language and said access to care for all Texans. They ain't hearing it. Texas has the highest uninsured rate in the country. You can't have good health outcomes in that environment. It's bigger than your behavior, folks. And I want, if you're a woman or man on here living with HIV, I want you to know it is not your fault. I don't care if you shot dope. It is not your fault. We didn't bring HIV into our community. There's nothing we did that says that the viral load in this community is higher than that one, except to aggregate a lot of poor people in a one neighborhood. So residential mobility, all of those things impacts or mass
Mm-hmm.
incarceration. Where do
Mm-hmm.
our people come back to? So I want you to think of it in a bigger context, no matter what lane you choose to work in. And trust me, I'm not advocating for everybody to say political determinants. I want you to say building political power, voting, and every lane works. If you're here on prep, prevention, we got to keep all that going while we're building power. And we need all those solutions. But I'm telling you, those are band-aids until we can build power in the ways that we know need to be built. Next slide. And these are just some examples, and you all can do way more. I just kind of created this because after delivering this political determinants of health and more people are asking for them, I want to show you all some concrete ways. And we looked at this from an individual, organization, and systemic way. And some of them go back and forth. Advocacy, being on here, political education, leadership development, voter engagement. You know, Stacey Abrams said she used to want to just turn out a lot of voters. Now she wants to turn out informed voters, right? So voter engagement, people might not believe apathy is real, and I understand it, why we've got to turn out. You know, storytelling, strategic storytelling, and narrative shift. That was my mistake. I mean, it's power building. The more we can tell our stories, and our stories need to be collected by us. United We Rise. We got to collect stories, or so that we can illustrate the examples of what we're talking about and the power building ways that we are working, what's working for us and what we need. Uh, Build your skills. If you're in an organization, how do we sustain those organizations? How do we share resources? How do we co-locate to save money in this political and economic climate? Every organization ain't gonna make it, y'all. So are we looking at, can we share accounting services? Can we co-locate in one building? Can we provide meeting space to the communities who are looking to organize? I worked for a FQHC for 5 years. They had no idea the shit that went on in that office after dark. We used every one of those their conference rooms for something. For I mean, we had a lot. And if you are in a building and you know you have some unused space, offer it to the community. Offer voter registration information. That's nonpartisan to put up there. I worked at a FQHC. I had people once a month, they manned a voter registration table so they can talk to people going in and out the clinic. There are ways to do this. Deliver training programs, partner with others who are delivering it. You ain't got to be the subject matter expert. On a systemic level, build coalitions, build intersectional coalitions, so whether make space at tables for others. If somebody ain't there, you are there. Make sure they extend that invitation. Share resources and data. We've all been trying to go with this American exceptionalism and things, and we only want to fund and build our house. But I remember the day when funders look for you partnering with people to go after funding. Now we just go after funding on our own. We need to revert back to what worked for us, and two or three of us go for funding. Let's not build redundant services. If I do this better, you do that better. Let's share. Let's create information hubs where information can be shared. Pool staff. If your organization don't have the money for communications, maybe you can share communications with someone who does. Support grassroots strategies. While we're on here today, these ladies reached out and said, we want to do this. Well, let's do it together. Let's share strategies that will help us all. These are only a few. Please drop some that you're doing. Education, mutual aid, food bank. They might not seem like building power or opportunities too, but every time you touch someone, you can give them a voter registration card and saying the way we ensure you get this food is, can I put you down as a pledge to vote? I will reach out to you back then. Or can I ask you, we every time we interact with someone, we have the chance to engage them in ways that they may want to be engaged or didn't know they could be engaged. So think broad, but you're never only doing this. Anytime you're touching another person, you have the ability to transform them into something. Or churches, y'all. One of my favorite, get to know the church secretary, whenever I'm in community. So churches, I have had more meetings in church, and I'm the biggest non-church goer, but they are a community resource. That used to be the bed of civil rights. When we couldn't meet anywhere else, we could go to church and meet, because that's the only time that the man will let us off, and we could go to church. And that's where a lot of our initial strategies were developed. Let's take it back, y'all. Next slide. So there's way more than that to do. So those are only some examples, y'all. There are so many more. And if you ever want to talk about more, I'm developing more examples, but I guarantee you all know other examples. And just putting a power building framework on what you do is all you have to do. You ain't got to remember all this slide deck. You just got to say, how do I ensure that my action will result in more? And so I want to end with this that just says about the importance of intersectionality, because, and I'm not going to try to say the name of y'all group, the Women of Color, and from NHAAN, y'all, you all in your framework are looking at how you can support others as they can support you, and you can build together. I wanted y'all to understand that Black women were the basis for the intersectionality framework that was developed by Dr. Lee Kimberly Crenshaw. And we can talk more about that. I know I'm probably running out of time, but I want everybody's using it as a buzzword, but Black women on here, it came from you. And it was the lens through which you can see that power comes and collides with us, where it interlocks and intersects. It's not simply that we have a race problem when you think with Black women. There's a gender problem, there's a class problem, so how our politicized identities intersect to bring the multiple types of oppression on us. So you can't just say I meet oppression because I'm Black. No, my gender, where I live, my status, and so much more. Okay, so if we don't see us in our fullness, we will also minimize the degree to which we are impacted. Next slide. So I know you all have talked about this. We don't live single issue life, but I wanted to let Black women know it started with y'all. So this idea of intersectionality is this ongoing process of creating ties across groups and identities that improve our ability to sustain power and transformative potential, which means we need to work together. Now, it don't all have to look the same, but we don't live in single issue lives, and there's power in our differences. So I see community as a house with many rooms, right? In the Black community, I might have a room of same gender loving men. It could be cis women, trans. I see us as one big family, but if you get over here, the value of the whole house increases, right? It don't have to just impact me. I'm happy when my brother got, because we all get, but when women come up, everybody come up too. So we all benefit when we work together and not against.
Mhm.
I don't believe in scarcity, and I don't see that white supremacy culture depends upon us fighting with each other for resources and visibility. Intersectionality invites us to support inclusion in different ways. They may not be in your group, but maybe making a seat for them at the table, supporting that group with space, writing a letter of support, offering to include their slide. When I'm in a room and trans women aren't included in the data, I'm going to raise my hand. Intersectional solidarity is necessary for our survival, y'all. We will not survive without it. And so that can be intersectional coalition building. That could be just the way we work. Now, like the caucus I'm a part of, we have a commitment to language justice so we can make sure we create a table that is not oppressive due to language and culture. So there's all kind of ways. Access to a Zoom account, y'all, is like gold for people who want to meet in rural communities and can't get there. So I will stop here. I think you all get it. And I really commend this group for already being here, whether you knew the word or not. And I got this word from Max Boykin, so I will not pretend that I just love the idea. So again, Black South Rising, our major theme and mission is about building power to improve health outcomes and promote healing. And I believe that building political power is the only way we're going to improve the conditions that which you all identified in that thing. I want some of y'all to run for office. I want some of y'all to become staff for elected or public officials, because staff has power. And so there are just many ways to do it. And I'll stop now and see if there's questions, because y'all know I could keep going. So I appreciate being asked. And yeah, I'll turn it back over to Dr. Diggs and Cecilia.
I have a question, Benita. So,
Mhm.
can you talk about advocating at the state level, like we do with AIDS Watch?
I so um I started something in Texas called the Texas Strike Force in 2019. Some of you may have heard about it. I don't get involved in as much because I don't believe in gatekeeping, and I train people so I can move on. But one of the reasons I started that, because your state legislature, for one thing, politics is local. We all have our eye on DC, but the real and has a huge impact. But state legislative advocacy work is critical. It's where major decisions that affect your daily lives are made. And so we all run to go to DC. I wish we'd run that hard to just go to the state capitol, because that is where it needs to be. The overturning of Roe, the fight is at the state. So much of what we are seeing in this this administration is this idea of moving stuff back to the states. There was a reason why the federal government was created, because states couldn't be trusted and we needed uniformity and all of that. But so much of the decision making that impacts your daily lives happens at the state. And so I believe before you can really take action at the state, y'all need to stop and become familiar with the structure. You cannot advocate if you don't understand how the rules work, how the game works there. And what I did for the first year or so was just first showing people the importance, what the committees were, what they do, their budget cycle, all of that. And then getting people familiar with their website online and teaching them how to go monitor, follow your own representatives first and sign up for their newsletters, because all of your representatives state, if you don't know them, everybody on here should know who their state representatives are. We know who are federal, but I find most people don't know their state. Sign up for their newsletter, begin to watch them, because if we have something at the state we want, we can all go talk to them, but they're really going to listen to the person who is their constituent. But we can build power that way. So let's learn about how do we monitor bills? How do we create action alerts? State level advocacy is to me, one of the key ways to build power. You can do it at your city level and at your county level, but state level is critically important. And I love to see more folks build coalitions to work at the state level. I hope I answered you or it took
You
forever.
sure did, and you confirmed my thought. It's like we got to get to the state. AIDS Watch is wonderful, but I need to know my representatives. I need to meet them
Yeah, get to
at
know. Well,
home.
you can do that without nobody helping you, but towards the end of the year, AIDS Watch will, and some of the people on here may have gotten a grant. They are giving grants. Last year, they gave to about 8 states to fund AIDS Watch at home activities. Some people are doing a series of trainings. Some people are doing advocacy days. So look out for um, that funding notice. But yes, yes.
Absolutely, we'll keep an eye out. Then thanks for that. Appreciate it. I love it. Are
Vanita,
there any
thank
other
you.
questions or comments? I want to open the floor. We got a minute.
Yeah, we got
No, huh? I'm so
one
sorry.
more
Y'all know
minute.
if you
This
know me,
is
I
this,
wanted to make a comment about something Vanita said about the minimum wage that nobody talks about, that doesn't get any attention. There are so many people who work full time or who work double full-time jobs and are homeless. And the reason they don't count and you don't see them because they're not laying on top of the uh that steam thing. They're in a car or somewhere else as a family. But we have to demand that living wages, and we have to let them know what a living wage is because obviously they have no idea.
California increased about last year or the year before increased their wage to $20.
Whoa.
Nice.
And that's
Okay.
still not enough.
And
Mhm.
it isn't, but my point. So
It's
when these
better.
folks are running for office in your state, go there and ask how they feel about minimum wage. You need to ask. That's called bird dogging, where we catch those candidates and get them to commit to something on record. That is another strategy that that we can use when candidates are running for. That's their most vulnerable time, y'all.
Yes,
But
we
when
need
we
we
start
need
electing our own, we got to see ourselves bigger than just a woman living with HIV over here. They ain't that smart. Y'all see what the dismantling of DEI is supposed to get rid of this idea of unqualified people and get back to an era of meritocracy. That is such a farce, y'all, because we are not seeing qualified people doing this. White mediocrity is being excused for excellence, and it is not. So every one of y'all on here could run for office. Every one of y'all on here could run an organization. Everyone on here can be a staff member of a organization or a elected or public official. Okay,
absolutely. I
we
think
are
we
bigger
need to
than we
have
know.
a training for state level advocacy. Anyway, that's all I got, y'all.
yes, this was amazing. This was such great information. Thank y'all for being on here. Thank you, Vanita. Thank you so much. Like
Thank you.
rising this information, a lot of people are not getting, and it's up to us to make sure that we share this information. Even if you don't understand everything, that's okay. It's not for you to understand everything because I certainly
Not all at once. No.
not all at once,
And
but
Dr. Diggs and Cecilia now are capable of coming doing the training. You can always reach back to Black South Rising, but now our goal is to train others to do this
yeah.
because and you can inspire and motivate others. And now people are reaching out with ideas for doing stuff, and now we get to help them with that. So
Yeah, this was such an impactful message for me. It really, because we know, but we don't really know. We think Washington, D.C., and social determinants of health. I'm in my little bubble, and I'm affected, because of social
yeah, you say,
determinants of
why are
health.
we so impacted? Oh, it's the social
Yeah,
determinants. Well, what does that mean?
Right.
exactly.
Start
Exactly.
asking
So
why.
yeah, I have to think broader and you know advocate where it's going to be most effective. Thank you so much, Vanita. I really appreciate this.
Thank you,
My
Vanita.
pleasure, y'all.
Thank you. Thank you
Alicia,
all for
Dr.
staying
D.
on. Y'all have a wonderful rest of your day, rest of your evening, and hope to see you, if not in person, in these internet streets like we do, y'all.
Yes.
Thank you so much, ladies and gentlemen. I appreciate y'all.
Thank you, Michelle. Have a
Bye,
good one, y'all.
Bye-bye.
Bye-bye.